In 1985, when I was 12 years old, my grandmother was diagnosed with breast cancer. She underwent a single mastectomy, chemotherapy, and went into remission. Luckily, she never had another reoccurrence in either her other breast or anywhere else in her body, and she lived to be 83 years old. Breast cancer is the most common form of cancer in women. There are two very useful tools that we have at our fingertips that a lot of times either women don't know about or women just don't use. And one of the first ones is one that you can do yourself, and it's a monthly self-breast exam. Very important, very easy, and I know even for myself, I don't do it like I should do it. You know your body. It's easy for you to do. You can look in a mirror and you can look at your breast. You need to look at it to see if you see any changes in color, or if there are dimples, or if there's any type of a rippling or a lump. You need to be able to feel your breast. You need to see if you feel for any lumps or any changes in tissue that you didn't notice there before. And you also need to look at your nipple for any type of discharge or any blood. Those are all very important and very simple, and if you know what you normally feel like, when there's a change, you'll catch it. Another thing is when women turn 40, it's recommended that you get a mammogram. A mammogram is actually just a low-dose x-ray that looks at the tissue of your breasts in order to see any changes or to see if there's any lumps. There are many types of cancer, but because breast cancer is it's such a difficult one to deal with for women, because it's a part of your body that is so, it becomes so important. And breast cancer is a cancer that originates in the breast tissue, mostly the lining of the milk ducts, or the lobules that actually supply the ducts with milk. And breast cancer accounts for 22.9% of cancers worldwide. According to cancer.org, a risk factor is anything that increases the risk of you getting cancer. And there are different types of risk factors. Some of them you can control and some that you cannot control. Some of the ones that you cannot control are just being a woman. Being a woman makes you more likely to get breast cancer, although men can also get breast cancer. Aging is another thing that comes up. The older you get, the more likely you are to get breast cancer. Your family history. 5 to 10% of all cases of breast cancer are actually hereditary. Personal history. If you've had breast cancer, you are likely to get it again, or you can get cancer in other parts of your body. And lastly, race. Being a white Caucasian woman makes you more likely to get cancer than an African American woman. But an African American woman is more likely to die from breast cancer. Native Americans, Asians, and Hispanic women are the least likely to get breast cancer. Some of the risk factors that are in your control are these. The first three kind of go hand in hand. The first one is your weight. After menopause, becoming obese or gaining a lot of weight is very dangerous. You need to try to control this by two things: your diet and exercise. And so all of these three things that, if you don't do them, can really cause a lot of problems. And so you need to take control of what you eat. Make sure it's healthy, make sure it's good for you. And go walking. I mean, just a simple thing as walking every day helps to control the weight, which is one of the other really big issues. Another couple items that go hand in hand are smoking and alcohol. Smoking, we all know, is bad for us, although you're around it all the time. So sometimes there's things that you just can't help, but you cannot smoke. I mean, that's a choice you make. Also, the alcohol consumption. It's okay to have a drink, but to go overboard and drink too much is always a bad thing, and it's bad for your body. Estrogen levels are also another thing that are known. If you have prolonged usage of estrogen without breaks, that can be associated with breast cancer as well. And two things that I never even knew about are stress and anxiety, which, I think a lot of us in our lives have a lot of that, so it seems like an odd thing to be a risk factor for cancer. But they do say, although they know these are things that they look at when they're looking for risk factors in breast cancer, they don't know how much all of these play a part in it. But they do know that they are an important part of looking at where it comes from. According to breastcancer.org, 1 in 8 women in the United States will develop breast cancer. And in the year 2013, it was estimated that 340,000 women would be diagnosed with invasive breast cancer throughout the world. That's a big number. But they also know that since the year 1989, the deaths have decreased with breast cancer, and they think that's due to treatment advances, earlier detection, and screening, and just self-awareness. You know, we as women, we need to be in control of our breast health. You need to know what's normal for you and what's not normal for you. If you take the time to do a monthly self-breast exam, you know what you're looking for, you know if there's a change, and maybe you can't prevent the cancer, but you can catch it early enough that maybe the treatment will take care of it, and that's all you'll have to worry about.